majority of you refer to a surgeon, and then pretty evenly split the rest of you between ultrasound guided true cut and surgical wedge resection via an exploratory laparotomy. None of you responded with laparoscopy. So thank you for sharing. Obviously, there's no right or wrong answer there. I was just curious as to what is most commonly occurring out in primary care land. When one submits tissue, we need to do more than just routine histopathology. We need to know where the copper is accumulating most, and we need to measure liver copper concentration, which is done via atomic absorption spectroscopy. Normal liver copper should be less than 400 and greater than 120. If we're less than 80, we are deficient. Copper storage disease is often described as being primary or secondary. And again, not to cause PTSD, but we need to recall the zones of the liver. So we have zone 1, 2, and 3. And zone 1 is often referred to as being periportal, while zone 3 is called centrilobular. Primary disease is typically associated with a copper concentration on a dry weight basis greater than 1,000 micrograms per gram or parts per million. And it has a centrilobular distribution. So you see most copper around the centrilobular or zone 3 region. In contrast, secondary disease is associated with a copper concentration between 400 and 1,000, and it has a periportal or zone 1 predominant distribution. And unfortunately, there are some things that affect concentration results. There is variability from one liver lobe to the next. If you sample a predominantly fibrotic lesion, that's going to give you a falsely decreased copper level. If you end up sampling a regenerative nodule, that's also going to lead to a falsely lower liver copper concentration. So when submitting tissue, make sure that you're working with a pathologist that is comfortable looking at the liver in this regard. And many of the reference laboratories like IDEX and Antec, at least here in the US, have specific liver pathology groups. And I would absolutely encourage, if not insist, that liver be submitted to one of these groups who basically all they do is look at liver tissue.